Okay, the class of 2018 may be seated. Okay, I would like to give a warm welcome to the class of 2018 and all their loved ones and guests who are here today, as well as friends of the college and special guests that we will introduce in a few minutes. My name is Jim Herron. I'm the Associate Dean of Student Affairs for the college. I've also been a faculty member here for the last 28 years, I think, though I kind of lose track. So I would like to thank you for helping us celebrate the class's 2018's entry into the profession of pharmacy. Also, I have one announcement that I better do now because it's on my note card. The parking services people were not supposed to ticket anyone today that was parked out here, and apparently there was a slip up. And so if you happen to get here early, there's a chance that your car may have a ticket on it, but we got them stopped before that. And so I'm told that for once in your life you may tear it up and throw it away if you were actually ticketed. Okay. Since this isn't a class here, I won't ask if there's any questions. Okay, so let's talk a little bit about why we're here. I'm going to step back so I'm not so loud here. White coat ceremonies first started about 25 years ago to basically mark a student's rite of passage or transition from preclinical studies into a career in healthcare, basically. And so you have all basically done well in your pre-pharmacy classes, and so this event to a day marks that point, this rite of passage where you are now going to get your white coat. And it's a good time for us to give you your white coat because your clerkships actually start later this fall. And so that's one of the reasons why we basically do the white coat now instead of later on in the 3 years and 8 months, like I told you on the first day of orientation, that you'll be with us. Also wanted to mention that white coat ceremonies first appeared in medical schools about 25 years ago, and that now most of the schools in the health professions areas do some sort of a white coat ceremony. I should also say that we hope that this will also mark a really important change in your attitude towards basically a lifelong service to your patients and the other people that you serve. Okay, and so that's one of the things I'd like you to keep in mind today, that we want you to have this lifelong career dedicated to a service to your fellow man. And so anyway, for the rest of the audience here, I would like to have you join me in basically giving our class of 18 a round of applause here. And now, I'd like the class of 18 to thank their loved ones, family, guests, and all the people who made it possible for you to be here today. Okay, so the first person I would like to introduce is our interim dean, Dr. Kristen Keefe, and she will give a few remarks and then introduce one of our first very special guests. So, Kristen?
So I am going to be brief. The students, I've seen you before. You're my class. You're my dear class because I think you're going to be my only class as dean. And so I've challenged you already to not be afraid to do great things and accomplish great things here. And I'd like to thank the families as well and who have gotten them to this point and encourage you to continue to support your loved ones as they embark on this path, because I am expecting great things from them. And so I look forward to your coming years, and remember that it's not just about you and doing great things for yourself and getting good grades and so on, but this white coat ceremony, I think, marks your transition where you're thinking about what you're going to learn and what you're going to encounter and what you're going to achieve is actually for the benefit of your patients. And if you do that well for them, you will win too. It will be a win-win. So really turn your focus towards your patients as you're studying and working through your degree, and everybody will benefit and be better for that. So I'm looking forward to your successes over the next, I guess, 3 years and 8 months. You have a lot of great role models around, and one of the most outstanding role models I think you have on this campus is Dr. Vivian Lee, who's our Senior Vice President for Health Sciences. Can you all see me? Like, I'm not even sure you can see me. Dr. Vivian Lee, our Senior Vice President for Health Sciences, who is an MD, a PhD, an MBA. She got her degree at Harvard Radcliffe College, went on to get her PhD at Cambridge, Oxford, sorry, I knew I was going to mess that up, as a Rhodes Scholar, and then completed her medical degree at Harvard. She did her MBA while she was already a faculty member, had a number of children at that point, and so you really don't have to look very far to find role models for people who are achieving great things. And she not only runs our Health Science Center and the university hospitals, but also is really taking on a very prominent national role in defining how healthcare is going to look. And so this is going to impact your career, obviously, and your practice of your profession going forward. And so it's my pleasure to introduce Dr. Vivian Lee to you.
All right, thank you very much, Kristen, for that wonderful introduction, and allow me to extend my welcome to all of you, class of 2018, and we are particularly pleased to have you joining the University of Utah College of Pharmacy, which I think you will appreciate is really one of the shining stars of our whole university. This college is home to some of the most outstanding educators and researchers and clinicians on campus, and we are particularly proud of some of the national recognition that the College of Pharmacy has received, including consistently being in the top of among the top of all the colleges of pharmacy in the country in research, and most recently in USA Today, US News and World Report being ranked again in the top 10 as a training program. So those are just some external metrics, but we know inside also that there are so many strengths that are represented and maybe not necessarily nationally acknowledged, but that we understand are true strengths here that you are going to be able to benefit from as well. I just have two brief remarks to make today. One is to talk about the symbolism of the white coat, and the second is to welcome you to the family of the health sciences here. So the white coat ceremony, which most of us faculty did not go through because, as was pointed out, it's a relatively new tradition, is a very symbolic one. And there, I think, are really three main elements of that symbolism that I wanted to emphasize today. The first is that the white coat is like a laboratory coat. And so when you don this coat, I think you should be reminded that what we are entering into is a scientific profession, that our decision making should always be rooted in data and in evidence, and that we should continue to strive for advancing our scientific knowledge and discovery in whatever aspect of the health sciences that you're in. The second is that when you put on this white coat, you are immediately, you will undergo this transformation when you start to encounter your patients, in that they immediately start to share with you some of their most personal concerns, and there's a trust that is implicit in you wearing the white coat and the relationship that you have with those patients. And I think you should strive over the next few years, and then of course throughout your careers, to really earn that trust and deserve that trust. And then the last is that there's actually, I also think of the white coat as a uniform. So it's like a policeman's uniform or a fireman's uniform. It's a uniform that you wear, and you just have to remember that that's just one part of your identity, and that underneath you're just a regular, normal human being, and that I hope you have a life outside of your profession and outside of school. And I just want to encourage you, even though it's not so easy to get through PharmD school, I hope you will take the time to develop the other aspects of your lives and to take the time to share with your family members and loved ones. The second point that I want to make was to welcome you to the health sciences and to say, as Kristen alluded to, that we are very interested here at the University of Utah in advancing and really helping to transform the way healthcare is being delivered across the country. And you will be joining a campus that is very focused on this, and a critical element of that new future is the team approach. So I hope that you will feel that you're joining a campus as a member of the broader team, including your partners in therapy and speech and communications and nutrition in the College of Health, including the nurses, including the folks in the dental school, our new dental school, as well as in the medical school and our physician's assistants programs and many others. You're part of that family, and I hope that as part of your training you will really come to appreciate how teamwork and collaboration with the other professionals is going to make you better pharmacists and also better able to deliver care to your patients. So with that, I just want to echo everyone in welcoming you here, and congratulations on making it so far, and I look forward to very bright futures ahead for each and every one of you. I now get to introduce our next speaker, Dr. Richard Cox. Dr. Cox received his PharmD from the U in 2002, so he's a distinguished alum. He is currently the Assistant Director of Inpatient Pharmacy Operations at Intermountain Medical Center. He has served on the board, the alumni board, for the last 3 years, and is entering his second year as president of the alumni board. So please join me in welcoming Dr. Cox.
Well, thank you very much. I am very pleased to be here with you today. I hope to see you in the next couple years out in our sites and participating in our rotations. But before I get going with the Distinguished Alumni Award, I do have to, as president of the Alumni Board, I have to give a little plug for the next big test you have, and that is the alumni, faculty, staff, student softball game coming up next Thursday. Now, it's a big test because there's only been one time that the students have won the alumni. So, no pressure. But there's only been one time. I won't say that was last year, but anyway, just so you know. All right, it is my honor to present Dr. Daniel Witt as a Distinguished Pharmacy Alumni for 2014. Dr. Witt graduated from the University of Utah College of Pharmacy in 1990. He then completed his PharmD and residency at the University of Washington and Harborview Medical Centers. He went on to do an advanced residency in primary care and family medicine at the University of Washington. Just of note, I did find out that he also is a distinguished alumni of another prestigious institution, Snow College, which we both share. Since the completion of his training, Dr. Witt has worked for Kaiser Permanente in Colorado, helping to develop and manage the clinical pharmacy anticoagulation service, as well as directing their ambulatory care PGY2 program. Dr. Witt has been active in the pharmacy profession, devoting countless hours and volunteering to the pharmacy community. He was recognized as a fellow of the American College of Clinical Pharmacy for his many contributions in 2004. He has received multiple awards for his publications and is held in high esteem within the pharmacy community. Dr. Witt began his new position as Vice Chair of the Department of Pharmacotherapy and Assistant Dean for Clinical Affairs at the University of Utah this past August. We are very lucky to have him back in the pharmacy community in Utah, and I am very honored to present this award to Dr. Dan Witt. Thank you.
Okay. I'd like to do a couple more recognition and thank yous before we get on to our keynote speech tonight, or this afternoon as the case may be. First of all, you're going to be working very closely with our college faculty for the next 4 years, and you're going to get to know many of them well. And so I would like to ask the faculty now to stand up, and we will give them all a round of applause. So we've got some sitting here and some sitting here. Next, I'd like to thank the Zen Trio for their pre- and post-lude music here. The Zen Trio consists of Mike Cameron on drums, Michael Case on bass, and Spencer Kellogg playing tenor sax. So, Zen Trio, where are you guys? Now, to a plan for this white coat event, I think we started on this more than 6 months ago, and it has involved a lot of people, and I'd like to recognize them. There's quite a few of them, and so as I call each name, please come and stand in the front so you can all be seen, and I'd also like to have you hold your applause till we get all of them out here. So the very first person is one of our staff members in the Student Affairs Office, Heidi Bates. And Heidi took the lead with this event this year, and so anyway, we're all very proud of the job that she did in organizing this all. Next is Shauna Webster, and then Maddie Marshall, Ashley Malili, Katie Washington, Thomas Martinez. I believe that Laura Hamilton is not here. And then finally, Danielle Keddington and also Ryan Boyack from our development office. Is Ryan here? Okay, here comes Ryan and Danielle right now. So once again, thank you, ladies and gentlemen, for all the help that you did in planning this event, and we all really appreciate it. Okay. Next, I'd like to call on Dr. Mark Munger, who is our Senior Associate Dean at the college, to introduce our special guest speaker.
Let's see if you're awake. Good afternoon. Oh, you guys are great. Let me just talk to the parents and loved ones of the students. I've had the opportunity to have your students in class for the last 3 weeks. They are tremendous. They are bright, they are articulate, and they are full of energy. So we're hoping that all 3 of those will continue throughout their 4 years. So we're really blessed to have all of them with us. It's really my distinct honor and pleasure to introduce our keynote addressee today. Greg Bell was born and raised in Ogden, Utah. He graduated from Weber State University and the S.J. Quinney College of Law at the University of Utah. He practiced law at both Curtin and McConkey, and most recently at Fabian and Clendenden. And he is also a past mayor and city councilman in Farmington, Utah. He was the chair of Envision Utah, an internationally acclaimed collaborative land use and transportation planning organization. And he's been president of the Farmington Bay District of the Boy Scouts of America and was awarded the Silver Beaver. He has also been active in a variety of community initiatives, including serving as the chair of the Homeless Coordinating Council, the Utah Commission on Volunteers, and the Utah Multicultural Commission. And I'm not finished yet. He's the president and CEO currently of the Utah Hospital Association, but he brings more than 23 years of public policy experience to the Utah Hospital Association, having most recently served as a lieutenant governor of the state of Utah and previously as a senator and in the leadership of the Utah State Senate. It was my privilege 2 years ago to meet Greg for the first time. Dr. Lee and I were both appointed to a task force for the State of Utah Health Innovation Grant for CMS. And at that time I met him. He was going around the room shaking hands. I introduced myself and he said, "I've got some great news for you. I just met with CVS this morning and they're going to build 30 pharmacies in our state over the next 2 to 3 years." And so that was our introduction. And so I think you can tell that he's a very good advocate for pharmacy, and we look forward to his keynote address. But I've left off probably the most important part for Greg, I think, and that is he and his wife, Jolynn, currently reside in Fruit Heights, Utah, and they are parents, proud parents of 6 children and 23 grandchildren. Dr. Greg.
Well, thank you, Mark, for that gracious introduction. The worst thing about being a public figure is the introductions. But still, I've made so many friends throughout the state and in different places, different institutions in our state through my public service. And one of the most favorite has been my association with the medical school, the School of Health Sciences, the pharmacy school here at the University of Utah. It's been wonderful to see Dr. Lee come aboard and see her. She's from Oklahoma, and you might think of her as a tornado. She's very comfortable because that's what she is. Unfortunately, the legislature had cut the med school to only 80 positions and wasn't able to fund it during those hard recession years. So our goal was to restore that, and when Dr. Lee arrived, she said, no, we're not going to restore it. We're going to double the restoration. We're not going to go back to 100, we're going to 120. And I said, right. Politicians realize there's great power in incrementalism, but she's an absolutist, and she absolutely got what she wanted. I first want to say, and I recognize likewise Dean Keefe and our other faculty members and deans, my good friend Dean Munger. It's been a wonderful association. But I want to thank the Skaggs family for the place in which you'll receive your terrific education. Many people rail against the wealthy. It's stylish now to not like wealthy people. Well, without becoming political about that, let's just nonetheless realize that someone aggregated a lot of money and was extraordinarily generous in effectively paying for the entire structure which you inhabit, and you'll spend your next 4 years. When you're done, I'll be in a rest home if I'm alive. So I really want to speak clearly so you can remember me in my lucid condition. It's amazing that you're going to spend 4 years. I mean, you got to know Prozac, I won't name those other ones, and a few of those mycins. Actually, pharmacy has become incredibly complex, as life has. Life in every aspect has become so much more, let's call it sophisticated, because of our ability to invent technological responses to problems and needs, and even technological adaptations to non-needs like gaming and things that consume our time. But this great technological revolution will bring, and already has, but will continue to bring, I think, to the factor of geometric factors, will be both good and bad. And the things I'm concerned about that you're going to be facing are, some of them are these. Number one, addiction. As we think about addiction, it really becomes pick your poison. Gambling, pornography, social media, errant thumb disease, chemical dependency. It kind of doesn't matter. Again, it's pick your poison, but it is becoming literally a plague. And we see it playing out. If you were to go to the Utah State Penitentiary and just take the people there that were directly there for drug offenses, for dealing, it would be a significant population. But if you multiply that by all the adjuncts, the related, the burglary and the check kiting and embezzlement and theft and violence, et cetera, it probably is north of 75 or 80%. It's driving a whole underclass of people, and it's driving a whole economy of crime. And you're going to be at Station Central in this battle, both in preventing its abuse and also in treating it. And it's a sad, sad thing to watch an addict, to watch an addict's family, to look at an addict's parents without retirement or credit, It's absolutely a plague, and it's something that you are going to have to do something about. And you're going to have to, number one, make sure you don't become an addict. Secondly, really we have 3 or 4 conditions that are driving our health care now, and they're all choices. They're all behavioral choices. And that's how we move, how we eat, and what we breathe. It just has to do with that. And so Americans are choosing incrementally in small little doses with great big platters of enchiladas like this to make themselves sick. And it's unaccountable, but we're doing that. And we have to reverse that trend. Drugs have become so awesomely specific and with limited side effects, so targeted that they have a tremendous salutary effect. But likewise, people now are having so many drugs that who knows what that soup does, who knows what that combination does. And you are the front line of that. You're going to be making those kinds of decisions. The complexity of payment systems. When you really understand, and nobody really does, but when you come close to understanding what our payment system is, you're going to say, who invented this? Who did this to us? And it will be lawmakers who did it a little bit at a time in different places. States, federal, rules, whatever. But the amalgam is an absolute non-understandable mishmash. But it still drives how we can educate you, how we can pay you, how we can educate other health professionals. It's a very, very complex system. And so you're going to have to work within that. I'm so glad to see that pharmacists are truly in the front rank of medical professionals in a clinical setting. You just saw the head of Intermountain's clinical pharmaceutical services. Pharmacists in hospitals and other medical venues are part of the team that are addressing so many medical conditions, including chemotherapy. And you think of the cure rate in cancer today, what a child stares at with leukemia, which once was a death warrant, and now is really a very hopeful outcome. And that's because of miracle wonder drugs. And I'm so glad that you're going to be educated and to become part of those teams that are going to make decisions. Because as I was speaking with the dean about a 5-year-old who's facing this chemotherapy, a lot of these drugs have been tested on 240-pound people, and all of a sudden you have a little midget weighing 40 pounds, and what do these drugs do, and what is the dosage, and how does it react with so many other things. So again, I'm glad for the tremendous education you already have and you will be having, and I hope you like organic chemistry, because that's where you're going to live, isn't it? I'm worried about food safety, about such common things as E. coli and salmonella. Those are things we know and understand, but they just crop up. We've whipped these things. We've whipped polio and measles and mumps, and they're coming back because of social and political resistance to immunization. We're watching Ebola make a showing in Africa that is just nothing but sad, because the service is not there, because we have not given widespread access to the tremendous treatments that eliminate in America those problems. Now, here are the things I'm grateful for that you're going to be facing. Number one, as I mentioned, the increasing role you will have as a professional on a medical team in clinical settings. Secondly, we have to get in this country to a place where we call it a medical home, or Dr. Welby, MD, where people once had a conversation with a doctor who understood them and knew them and said, baloney, you're a hypochondriac. you don't need treatment for that, or wow, we better get you this specialty or this drug or whatever. But a gatekeeper, but not just a gatekeeper, a smart gatekeeper who appreciates the patient in front of them, has some history, and helps that patient make wise decisions, and can do it maybe through email and text and be paid for it. I'm excited for personal medical records, where I can take my own bank account and my own cell phone number, and pretty soon I'm going to be able to take my own private medical records at whatever provider. And I can take it from that provider and go to that provider, and everyone will have a record, including me. Imagine that I'll be able to see my own blood panels and my own record and remember what drugs I took 25 years ago. It's going to be a groundbreaking development. I'm so grateful for the progress we've made in medically treating mental illness. We have so much room to grow in. But this is a scourge. It's a difficult thing. It's hard enough. And then to face these conditions without adequate treatment or access to good drugs and good therapy is just a crime. I'm delighted to see how we're doing better in that. I mentioned this, but I'm grateful for the better outcomes in cancer treatment. I'm a 5-year survivor. I thought that was a big deal. My doctor said no big deal, it can come back anytime. But I thought it was pretty cool. And I celebrated if she didn't. But she found it, so she can do whatever she wants as far as I'm concerned. I'm gratified by the ever-diminishing nature of invasive surgery. It is incredible. I visited my grandmother in the hospital who had her gallbladder out and was in a bed for 7 days. And I know you think I'm old. I am. I'm 83 years old. But it's not that long ago. And we didn't move, right? Sick people didn't move. And so when they got up, they had no muscles and they were still sick because they hadn't even worked against gravity. And now we do so much in day surgery, and another profession that's come of age has been physical therapy. I'm so delighted to see that as well. I'm delighted to see Medicaid being expanded, and I think we'll have that in Utah, a full expansion so people can make rational decisions about health care and go to the right place to get treatment instead of ganging up in crisis at the emergency room. I frankly am just delighted to be associated with you today, to look into your faces, to see the young women. And I got to tell you, I'm being a little sexist here, but my experience in law school was that women study. They do their homework. They take legible notes, and they show up. So you guys just remember that, right? I see most of you are young, but clearly you've excelled in undergraduate. You've gotten your act together. And that's wonderful, because you're going to be contributing adults. You're going to be professionals. You're going to make a tremendous medical contribution as inventors, researchers, as clinicians, as people dealing with the public. But you're also going to make a good wage, and you're going to contribute to your family's welfare and to your community. And you'll be able to help your children get a good education. And I think you will agree, some of you were born in a log cabin, and not really, but you came from difficult circumstances. You weren't born to the purple. But the reason you were able to get here was your discipline, encouragement of others, but it was because of your fine education. And people, not everyone has access to that, but those who do and who take advantage of it can climb out of whatever class they're in and become part of America and enjoy all our many blessings through making a good living. Well, I've spoken too long, but congratulations to you. Thank you for your devotion to this, for your desire to serve. Thanks to your parents and spouses and partners and caregivers baby tenders, whatever they are, who have stuck by you and are going to help you with your student loans and are going to encourage you and make sure you don't drop out, but that in June of 2018, you walk across that stage with great pride and great excitement, with a diploma and a job. Good luck.
Okay, thank you, Greg Bell, for some very interesting, pertinent, and relevant remarks. This is a very nice speech that you gave. So now I think it's the time you've all been waiting for, which is when we take your coats from your arm and put them on your back. Here's how this process is going to work. In a few seconds, Dr. Dave Young, one of our faculty members in the pharmacotherapy department, will come up here where I'm standing and read your names. And what we'll do is we'd like each row to stand up at one time, and then as Greg reads as Dave reads your name, we will have Dr. Jim Rubel, who is the 2014 Teacher of the Year in our college, actually COU. And then Dr. Rich Cox has a College of Pharmacy pin that he will give you. And then we will have a line of deans and VPs to stand there and shake your hand. And finally, we have this pledge of professionalism right here, and there's a line for each of you to sign, and there's lots of Sharpies. Okay, so that is the process. And then after all that's done and you're all seated again, we will basically have you repeat the actual oath that you have signed to it there as the closing event. Okay? I keep wanting to say any questions, but like I said, this isn't a classroom, so Dr. Dave Young, where are you? Okay.
Okay. Well, welcome. And the reason they have me read the names is because I have a big voice. I don't have a big body. And I know you all. You've been in my class for weeks. My little Padawans. This is your first step into Jedi training.
Yeah.
So as I read your name, you can walk across. You guys ready? Ready? Anna Adams. Loren Alai. Nathan Anderson. It's okay to cheer. Troy Andrus. Sean Bailey. Kennedy Bateman. Christopher Bell. Matthew Berncott. Joshua Brockbank. Daniel Buys. Vincent Chung. John Churchill. Nathaniel Churchill. Nathaniel Cordova. Jeremy Doherty. Benjamin Davies. Hyen Deep. Tanya Edenjiklian. Drew Favero. Cameron Floor. Trevor Gardner. Seema Ghaffarian. Tyler Gunderson. Vern Harden. Brooke Heaps. Chow Ho. Caitlin Holyfield. David Jackson. Kelsey Kelsch. Gina Kim. Koi Lei. Tracy Lee. James Lee. Daniel Manuel. Nicole Mendenhall. Cooper Millar. Natalie Moreland. Amber Neighbor. Ryan Nelson. Michelle No. Mihan Nguyen. Richard Nguyen. Andrea Nishimoto. Sydney Olson. Wilson Pace. Logan Peterson. Stephanie Prop. Crystal Rasmussen. Austin Reese. Amberlyn Winward. Andrew Tominaga. Austin Ulrich. Sydney Van Alstine. Patrick Welch. Emily White. Carolyn Yamashita. Jessica Young. Sheila Zamanifer.
I don't know, there have been many, many times over the years when either Dave Young has spoken before or after me, and the microphone always goes like that. So we have one more step, and that's to invite fourth-year student Andy Dwenger. I practiced how to say his name yesterday. I've known him for 3 years, and I really didn't know until yesterday how to say Dwenger, and I hope that's right, Andy. But I'm going to invite him to come up and basically lead you in the pledge that you just all signed. And for those of you in the audience, the pledge is on the back page of your program, so you can follow along.
All right, sharp-looking group of white coats. Looking good. Well, first off, I just want to say that I'm extremely honored to be here today to welcome you all to the University of Utah College of Pharmacy and into the pharmacy profession as a whole. Your hard work as students begins now, and over the next 4 years, you will experience many late nights of cramming and memorizing for tests, spending hours on the internet inputting Google searches of medical terms that you can barely spell, and using Wikipedia way more than you'd admit to any professor. Don't listen to that over there. But your hard work will pay off as you all grow through these experiences, both as people and professionals, I promise. So when I was asked to make this speech and give you the pledge of professionalism, I have to admit that I was a little nervous about what I was going to talk about today. In fact, I had not read the pledge since reciting it myself at my white coat ceremony. However, I was luckily inspired by simply reading the first sentence of the pledge. And the first sentence of the pledge, which you will recite with me in just a moment, reads, "As a student of pharmacy, I believe there is a need to build and reinforce a professional identity." When reading this sentence, I reflected back to my time when I was sitting right where you are today. Prior to that date, I had literally no pharmacy experience and honestly had no idea what I had just gotten myself into. In fact, I can remember at my interview when applying to the U that there was a panel of current students and one of them introduced themselves and made the joke, "I hope you all took your beta blockers today." I had no idea what they were talking about, and everybody was laughing, so I laughed along with them, just to act cool, I guess. But, by the way, I get the joke now, and it's actually kind of funny, and if you don't get the joke, it's fine. That can be one of your first Google searches later on. But the point of me telling you this is that I only came in with the public perception of what a pharmacist was. And what I found myself saying repeatedly over the last 3 years is, wow, I didn't know a pharmacist could do that. I've been shocked and amazed at all of the fascinating career paths that a pharmacist can take, and I guarantee you will also be exposed to routes you never thought possible. You'll be challenged and introduced to responsibilities and opportunities that go beyond what you think of when you think of a typical pharmacist. But this phrase isn't something that I have said alone. My friends and family have expressed the same awe and surprise when I describe to them my experience as a pharmacy student. My patients are amazed by the services and great care that I have been able to provide them, and my colleagues in other health professions have been impressed by and grateful for the services, recommendations, and patient care that I've been able to deliver. By simply being a willing and hardworking student of pharmacy, I have unknowingly been able to help shape the professional identity of pharmacy for those around me. But I am not alone. My classmates, the college, the faculty, and the other pharmacists all around the world have also been shaping the professional identity of pharmacy by expanding job roles and having positive impacts on patient care. And like gram-positive bacteria, we are spreading the idea that a pharmacist is a capable and important member in the healthcare system. So, over the next 4 years, I challenge you to think of the phrase, "I didn't know that a pharmacist could do that." And when you find out something new, tell someone about it. By simply working hard as a pharmacy student and applying the knowledge you gain in the classroom and on rotation, you can help join myself and every other pharmacist to strengthen our profession and establish our identity. We are a changing field that needs people just like you to continue making strides and opening doors to expand our role and influence and educate the public on what it is a pharmacist does. And with that, I am happy to welcome you all as colleagues, and I look forward to working with you all. Thank you for having me on such a special day in your life and career. It is truly an honor. So now, please join me in reading the Pledge of Professionalism. You can just read along with me. It's kind of long. All right, so back to the first sentence. As a student of pharmacy, I believe there is a need to build and reinforce a professional identity founded on integrity, ethical behavior, and honor. This development, a vital process in my education, will help to ensure that I am true to the professional relationship I establish between myself and society as I become a member of the pharmacy community. Integrity will be an essential part of my everyday life, and I will pursue all academic and professional endeavors with honesty and commitment to service. To accomplish this goal of professional development, as a student of pharmacy, I should develop a sense of loyalty and duty to the profession by being a builder of community, one able and willing to contribute to the well-being of others, and one who enthusiastically accepts the responsibility and accountability for membership in the profession. Foster professional competency through lifelong learning. I must strive for high ideals, teamwork, and unity within the profession in order to provide optimal patient care. Support my colleagues by actively encouraging personal commitment to the oath of pharmacist and a code of ethics as set forth by the profession. Incorporate into my life and practice dedication to excellence. This will require an ongoing reassessment of personal and professional values. Maintain the highest ideals and professional attributes to ensure and facilitate the covenantal relationship required of all pharmaceutical caregiver. The profession of pharmacy is one that demands adherence to a set of rigid ethical standards. These high ideals are necessary to ensure the quality of care extended to the patients I serve. As a student of pharmacy, I believe this does not start with graduation. Rather, it begins with my membership in this professional college community. Therefore, I must strive to uphold these standards as I advance full membership in the profession of pharmacy. All right, thank you.
Okay, well, first of all, thank you all for joining us today, all of the loved ones and guests of the class of 2018. This concludes today's events. We would like to join you, or we would like to invite you to join us in the light refreshments that are in the back. And also, since we'll have music while the class proceeds out, I'd ask the audience to remain seated until the class goes through the processional process. Okay, thank you.